You joined us late, and you've obviously come in from the hospital. So I'm sorry to have just got into this thing without any chat with you. But we have people joining us from across the country right now, even as we speak, on Zoom, on YouTube, on Twitter, and our various handles to listen to you and to on a subject as important as this.
Right.
So a little about Dr. Singh before we start. Dr. Aditya Singh comes with experience of around 2 decades in the field of neurosurgery. He is currently associated with the Indraprastha Apollo Hospital in New Delhi as senior consultant in the Department of Neurology. He has vast experience in managing brain as well as spine disorders, which include brain and spine trauma, vascular, skull-based neuro-oncology, and pediatric cases. His main interests include minimal invasive brain and spine surgeries. Additionally, Dr. Goyal has been an academician and has published his work in national as well as international platforms and helps to groom young neurosurgeons. He received a note of appreciation and momentum from Mrs. Mona Ashraff, the Indian Consulate in Switzerland. He was also felicitated by the Geriatric Society of India for his immense contribution to the society in October 2018. He recently received the International Board of Medicine and Surgery, the Emerald Award from them. His areas of expertise are brain and spine trauma, vascular injuries, neuro-oncology, and pediatric oncology. Welcome to Health Live at Senior Today, Dr. Singh.
Thank you. Thank you so much for the kind words, Dr. Maheshwari. And I'd be really happy to help the persons, whatever they want to listen about the dementia and everything, about my knowledge.
It's a very interesting subject that you've taken, which is to look after family members with dementia.
Absolutely.
And, so before we start, Doctor, how's in your part of the world, Delhi? This is a season when it starts getting. It's the festive season, but at the same time, it's the unhealthy season in that part of the world.
Yeah, absolutely. See, as you said, unhealthy season, you might have told because of the weather conditions, as well as along with the pollutions which Delhi has actually. And moreover, the festival season is on. So more firecrackers and the winters coming up. So these can be a problem to anyone. But these days, overall, it's the overall cases are low for last 1 week. In whatever cases it may be, could be because of the pollution or whatever COVID cases are, these are little low.
Let's hope it is, because for senior citizens, for our readers here who are listening in and who otherwise, it is a season for worry. So, but let's look at the subject now. Doctor, would you like to say a few opening remarks, and then we can leave it to questions from people?
See, the first and foremost thing is dementia. The word dementia itself means that it's whenever someone says about dementia, it's only we think about loss of memory, right? It's a chronic or a persistent disorder of mental process, actually, in which there are personality changes and personality changes along with memory loss, impaired memory loss. So that's the main idea of what dementia is all about. Now, talking to the main topic is regarding the caretakers. In our part of the world, we all know that dementia usually occurs by various reasons. But in our part, we think that it is more usually related to the elderly person. But there are few causes which are reversible. It can also occur in the young person also. But in elderly, there are different causes of dementias. Most important cause is Alzheimer's, right? Then comes, there are protein deposits in the body, in the brain, basically. That's called the Lewy body deposits. There's the protein deposits inside the brain, which causes, loss of memory in the areas involving the brain where the memory specifically occurs. And other causes are the vascular causes, and the reversible causes are the most important things. That's the lifestyle changes. In our part, we have, these days we eat junk foods and all. So these things causes the important nutrient deficiency in our body. They can be a reversible cause of dementia in young. Chronic alcoholism, smoking, these are the important things which, when we control, the dementias can be, controlled to a little bit, and these can be reversed actually.
All right. Thank you, doctor. But tell me something, doctor, since it occurs with senior citizens mostly, and who don't necessarily have junk food the way youngsters do.
Right, absolutely. I'll be talking about the specific causes of dementia in elderly. That's a totally different thing, right? In that cases, as you rightly, you're talking about that. So in those cases, there are few reversible cases also. First and foremost, the most common cause is Alzheimer's. Then comes the Lewy body. Then comes the vascular causes. Right. There are different dementias classification. The another way is frontotemporal dementia. These dementias which occur, these are progressive. These are progressive. These are not reversible. Am I audible?
Yes, you are. Yes, you are very much.
Yeah. So in the elderly, when you talk about dementias, most common is Alzheimer's. In that, it's when it occurs in the age of 50 to 60s, then, that's not a good sign, because Alzheimer's usually occur little late, maybe in the, near 70s or 80s, something like that. But when it occurs at the age of 60s and 70s, then, the lifestyle and the burden among the caregivers increases, and also the patient also suffers.
Doctor, this is all about, your subject is about, dealing with dealing with families that have somebody with dementia, and the role of the caregiver is significant. So, are there a few lessons that you would like to suggest to caregivers, what they should do, how they should cope with the entire with a family member, with somebody who's so dear to them, who is suddenly got dementia?
See, first and foremost thing is that when a person, when we are dealing with a person with dementia, the caregiver should understand few things. See, the person who has dementia, so we should not argue with him. First and foremost thing, we should understand his situation. So the main problem is he will never understand. Okay, so we have to understand to an extent that we have to tell him, if he argues anything, you have to stop there and you have to say that, okay, please tell me, how can I help you out? First and foremost, you should never tell them that, do you remember that? You ask them basically, whatever, do you remember your birthday? Do you remember this guy? Do you remember this particular thing? You keep on questioning. What we think, what caregivers think is that when you ask them, they try to recollect. No, actually, they get angry when you ask such questions because they are not in a position to remember the things. That's the foremost important thing. You have to be soft with them. You have to understand them, and you should never argue with them. You should never question them. These are the important things.
Right. That's an important point, that don't try to question them or try to test their memory, because that kind of puts them in a spot.
Yes, absolutely.
Doctor, you mentioned about proteins, deposits, etc. Now, how does one ensure that these protein deposits don't happen?
See, that is basically a degenerative disease. We all know that proteins are very important. These are these are not the routine proteins we are talking about, because these are Levy proteins, Levy body proteins. When they have degenerative changes, then only they get deposited. It will not get deposited when you eat a lot of protein. Okay, this is the misnomer. So you must understand that's not related to the normal protein which we talk about. These protein, which we specifically told you, they get deposited in the vascular nature of the brain, inside the area where, this memory place, basically the temporal region of the brain.
Doctor, another question which is there, and to all our viewers and readers over here, if you have any questions for Dr. Aditya Singh, please put them in the chat, in the Q&A, and as always, mention your age and the gender, so that perhaps doctor could give a more considered reply. Doctor, there's this entire issue about are there more cases of dementia these days? Is it since in your experience over 2 decades, do you find that there are more cases now than there were around the time when you started in the profession?
See, you rightly said that these days the dementia cases have increased. The reason behind is we started, we actually came to know about these actually. Earlier, people used to leave them aside. So they were not getting the proper care. They were not reaching the hospital. They used to be at home. They were left alone. These days, people are not ignorant. This initially at the early stage, they start visiting to the hospitals. They want the best care. So that's how the dementia patients have increased. Moreover, the second part is because of the lifestyle changes. The main reasons, as I told you, age itself is a reason that can be there. But in our part of the world, these days, elderly people, in many of the patients with dementia, their children doesn't stay with them, most of them. This is an important cause. They leave them alone at home and they go to their jobs, and everyone see. This is a 20th century, and you all know that everyone is up and above, and they are all working. All are, whether women or gentlemen, everyone is working around. So elderly people are left alone at home, and with moreover, they are made to stay at one place. True. And second thing, when they are alone at home, the age itself, the negative thinking, being left alone, not loss of proper diet, no one, these are the important reasons which, these causes stress factor to them, and they gradually get into the system. These are the factors which are specifically stress and everything, what all I've told you. These are the important reasons which causes pre-causes for the dementia. So accordingly, when the person stays alone at home, they are more prone. In Delhi and our surrounding area, we all know that elderly people are staying at home, and these cases are growing up gradually.
Doctor, the stress levels that exist in executives of today is so heavy, and I'm sure that's the case with doctors as well. Do you see that 20 years from now, given the fact that stress levels are so high, there will be perhaps a dementia pandemic kind of a situation?
So I don't think so, but one must actually think about it. See, when you are left alone for a second, when you are alone for a second, you'll get hundreds of ideas that, I have to do that work, I have to do this work, you'll go on the computer, laptop, your mobile, you'll be searching, you'll be replying. These are all, lifestyle changes where your mind is constantly working. When you're sleeping also, you're on the mobile, you're talking, there are lots of deals which are going on, whatever profession they are into. So these are the Earlier, there was at 8 o'clock, people used to sleep at 20, 30 years back. Now, in late night, 1 o'clock, 2 o'clock, people sleep. And more importantly, they are always preoccupied with some other work, which may be anything. So the stress levels are going up. Right. And when someone has given you 10 jobs at a time, then you'll certainly, as a human being, you'll forget few of the things. Otherwise you'll write everything in that's the stress which is coming up. So dealing with stress is an important factor now. Moreover, it's raining heavily outside. Everyone wants to join the webinar. It's at 5 o'clock, but heavy jam outside. That's a stress factor which is getting in, right?
Gosh, doctor, I put you through some stress because I know you had to rush back.
Frankly telling you, I was in jam for 1.5 hours.
1.5 hours. Yeah. That's what our cities do to you. Is city living, is the entire stress of city living causing, is that also a factor that is leading to such cases?
In a way, yes. People who have their, they are linked to, or who have their elderly family members in the, suburbs or village area, they are very happy going there once in a while so that they can breathe normally, they can relax there, they can put their mobiles to the side. When you are in the city, basically, the moment you land up, you are preoccupied with everything, with the family, with the children, with the job, with the work, the extracurricular activities, everything. Time management, we have lost it. The way the stressful factors, you run around everything in the city. That's how the stress is gradually growing up. That itself can cause the dementia itself.
Doctor, before we go to questions from our viewers here, one more question. You mentioned about the loneliness that people have, and the children do not really have time for their parents and grandparents. Would you say that assisted living homes is perhaps an answer for those people who are not able to take care of their parents the way they should be because of the time? And assisted living homes are no longer the type of the home for the aged that existed once upon a time. So do you think that is a solution?
I have been to such place for for a talk few years back. Maybe it's near next to Gurgaon, little suburb.
Bhiwadi.
Bhiwadi, right. So the way they approach, the approach has totally differed now. Earlier, it was like the elderly gentleman used to be kept there for a while, but these days they have all the facilities there. The work, from the nutrition part, from the caregiver part, their rehabilitation program, if they are suffering from anything, for that, the attendees, everything is there. Only thing matters is that you should be able to provide them that facility. But in a way, that's a very good platform for these people. They can go there and they can get, if they don't have any facility at home, then if they are feeling lonely, that's a good part.
Right. Thank you, doctor. We have a question from Sri Krishna Agarwal. This is for somebody who's 76, has been suffering from dementia for 10 years. There's a thought block and loss of memory. Is there any medicine that can slow its progression?
See, first and foremost is, you said he's elderly gentleman and he's 70-year-old, I guess, right? 70.
Right. 76.
76. He has thought block. So I just wanted to know, apart from thought block, since how long it is there? If it is only for some time, or it is for how long? He said, I think 10 years, right?
10 years, that's right.
10 years. It is a chronic problem. They must have visited other doctors also. Okay, they must have done the routine test that involve maybe cognitive from the MRI and everything. Later on, they must have diagnosed him with Alzheimer's. If it is there, giving medications directly without watching all this, going through all the things can be, that's not the right point. If it is diagnosed with Alzheimer's, there are different medications for it. First of all, the routine blood test has to be done to know whether there is any nutritional deficiency or not. If it is okay, well and good. Otherwise, replenish it. Alzheimer's, start with the medications, right? Then otherwise, there is other vascular dementias. For that, you need to give blood thinners and everything. There are different things. Only for the thought block, you cannot, there is no specific medication as such for the thought block itself. One must actually get into the details why exactly he has the thought block.
Right. Thank you. We have a question from Mr. Vijay Ferwani.
Right.
He asks, how does one deal with delusions? His wife is 80 years old and has practiced medicine for over 50 years. Since his wife cannot process sequences, she cannot understand TV serials. How does one keep her occupied?
Can you just repeat the last two sentences in that?
Yeah. So basically, it is on how to deal with delusions. His wife is 80 years old and has practiced medicine for over 50 years. The question is, since his wife cannot process sequences, she cannot understand TV serials. How does one keep her occupied?
See, she has been a intellectual lady. Because of that, she's little, worried about it, because she is unable to understand and she went into delusions and everything. So one must understand when she has the delusions, right? What kind of delusions is important? There are different delusions. One is persecution, in which you think that someone is trying to do something to you, right? One is nihilistic, which means that you are nothing. One is grandeur kind of thing, in which you feel you are euphoric. See, we have to understand which kind of delusions he is into. Other part, he told me, as you said, that she is unable to understand the serials. Before understanding the serials, whether she is able to understand the simple questions which you put to her, whether she is doing her routine activities or not. Is she bedridden or she moving about? Is she able to talk to everyone at home very easily? These are the things one must find out before saying it as a delusion. Every delusion has a different way to approach.
Right. Thank you. Doctor, we have a question from Mr. Shyam Mittal, who is from New Delhi, Rohini. Do diabetics have dementia? He says, I've had diabetes since 1984 and I have neuropathy. He is 71.
Yeah. Diabetes is also an important cause of dementia. And also, the diabetes can cause neuropathy. When diabetes are not controlled, it can lead to neuropathy, which itself means that the nerves are involved. Right. So it indirectly, there is increased incidence of dementia in diabetic patients. Right. And as I said that he wanted to just know that whether diabetic people have dementia, right?
That's right.
Yeah, they are more prone for dementia if they are uncontrolled sugar levels. If they can control their sugar levels better in a proper way, then the chances of dementia is very low. As you all know that every patient with diabetes will not end up with dementia. No. It's only few cases where there is no control about the diabetes.
Right. Thank you. We have a question from Kaushal Singh, who says, when do you think it's the right time to take a person to the hospital? He says his wife has been having short-term memory loss for the last 3 years, but otherwise she's okay. She can move around, but it's at times a little disoriented. What is the course of action for treatment?
See, whoever has dementia, the most important thing is that whether the person is, whether the caregiver are able to understand, whether able to take care of that. There are different levels of dementia, mild, moderate, severe. In mild, you can actually, mild in the sense he is forgetting what has eaten in the morning, in the afternoon, maybe late night. Okay. And these are the simple, he's kept these things in one place, he forgot the things. These are the mild cases where you can be managed at home. And the moderate comes when, everyone is worried about it. He goes out and he forgets the places. I'm giving you examples so that the level can be understood. Okay. Then in those cases where from the moderate itself, severe is, he doesn't know where he stays actually. And from the moderate dementia levels where he's unable to understand, unable to remember where exactly he's, he goes out and he forgets the places, what has eaten, spoken hour back, he doesn't remember. He doesn't remember the names of the relatives at home. These are the stages. This is the stage where you have to take him to the hospital, because he cannot be managed at home with these. He requires specific medications for that, along with the cognitive scale to understand at what level he is there.
Right. Doctor, the person who had spoken about his wife, who's a doctor, he has sent a message again. He says the main delusion is that the hospital has asked her to see patients, does all the routine activities, diagnosed for articulate dementia in December 2019, now confirmed as Alzheimer, does 30-minute walk daily, sees 2 medical webinars daily, but thinks the doctors have come home and offers them soft drinks.
No, last bit. Can the doctors of?
So when she attends medical webinars every day, 2 webinars every day, thinks that the doctors have come home and offers them soft drinks.
Okay, she is in a delusion that she thinks that when she attends this and she feels the doctors are at home, basically, right? Yeah. So, okay, I understood that, but what exactly does he want?
He just perhaps wants to seek some advice. What we suggest you could do is that we will give you the connect with the Dr. Aditya Singh. Some of these questions that you seek advice for are a little more complex, and they require some amount of one-on-one interaction. We will give you Dr. Singhs Connect at the in the takeaways that we carry on Monday. Those of you who are new here, you know that we carry takeaways of every health webinar session on Monday, along with the edited video of this session. So you will be able to watch it again, and you will be able to also look at the takeaways, which is incidentally written by a medical practitioner. So I suggest that it's better that you seek doctor's advice one-on-one, and you could write to him and seek advice. Doctor, we have a question from Suresh Kamath, who is 69. Being a fitness freak, he wants to know, by performing yoga asanas like Shirsasana or Savangasana, which helps in infusing oxygenated blood in the brain, will it help mitigate brain-related or neurological problems?
See, we all know that yoga is good for health. Whenever I'm not a yoga teacher, but I can just put few words about it. When you do yoga, there is concentration, there is increased blood flow inside the body. And because of that, whenever there is increased blood all over the body, the cells get nourished very well. When the blood goes to the different parts of the body, it carries oxygen also. When there is more blood inside the brain, the right amount of blood inside the brain, and along with that, there is good amount of oxygen. When you, that's why we say that the yoga has to be performed early morning, or in a place where, in the garden or somewhere you can have fresh oxygen. So obviously, when you do yoga, there is more amount of blood flow and more oxygen to the neurons, and in turn delay the such things, the dementia part and everything.
Right. Thank you, Doctor. We have a question from Mr. K.V. Brahmanand Rao. He says, Doctor, I'm in the habit of noting things down in a day and also keep reminders for everything on my mobile. Is it a right thing to do? And he asks, surprisingly, certain things I remember well, but faces and names of people faces occasionally meet or visit? I think he doesn't. He's 73 years old now, and he asks whether it is a matter of concern.
See, as he told clearly that he remembers everything except that the faces as well as names of the person he meets. So this is, I don't think this is an thing to concern, because there is a habit of writing. That's a good thing. Also, he specifically told that he remembers everything except the faces and this. So I don't think he has to go to the hospital yet to meet a doctor.
Right. Doctor, this, there are places which are focused on dealing with dementia patients. There are homes where I know there's one in Pune, there's one in Delhi, where which are specifically meant for dementia patients. Is that something that you would advise people to look at, because they're not able to handle the situation themselves?
Now, can you repeat it again, please?
There are some homes, there are some centers which take care of dementia patients. So families which are not able to take care of their loved ones who have dementia. Would you recommend these places, or would you just say that regular care is good enough?
See, it all depends upon to what grade is the dementia, part one. Second is how the caregivers or the children or whoever it may be are with the patient. Everyone, if they think that they cannot manage at home, two things are important. One is the level of dementia. Second is how care they can give, how much care they can provide. Actually, if they cannot, from grade 2, the patient has to be taken to a hospital, but they want to those centers where dementia care has been given. One must visit there. One must learn. One must see what all activities they are doing there. They can learn from there, and they can do their same thing at home if they wish to. Otherwise, they can keep there. There is a routine for everything. In dementia, where you rehab centers, you have a routine. They have to get up at this point. They have to wear their own clothes. They are made to wear their own clothes. If they can't, then people will help them. They have to eat, wear, brush, take bath. Everything is under vigilance. And if they cannot do, then there are caretakers with these things. They can learn from there, and they can do the same thing at home.
Right, Doctor. We have one question which perhaps would sum up things very well. How does one healthy person ensure that she or he doesn't get dementia problems in the future? This is a question from Suresh. Which nutrients one must take, or exercises that must do to avoid getting dementia?
So first, you cannot avoid genetic things. First and foremost thing. The other things which are important is, as you all know, that one must be fit enough. One has to go for a brisk walk every day to keep himself fit. And these days, we all know that we sit in the office the whole day. The early morning we wake up, by the evening we come out of the office. So there are lots of nutritional deficiencies. So it would be good to eat fresh, seasonally foods and vegetables. That would be the right thing to do. Brisk walking, do regular exercises. Gentle exercises doesn't mean that you have to go out. You can do it at home also. Other than that, routine investigations are important. Blood investigations. If you have any problem, just go to the doctor. You think you're unwell, go to the doctor so that he can do the routine test. You can find out what exactly you have at the early stage. If you have diabetes, you have to control it. Hypertensive, other cause, hypothyroidism. That's another cause of dementia. If people at young age have thyroid disease, hypothyroidism, they start on thyroxine. So these are the things which are important.
Right. Doctor, one last question we have from Mr. Sanjay Gajre, who says his father is 90 plus, having advanced Alzheimer dementia. He's not able to speak since the last 1 year. How does one cope with this?
See, you have to, the answer has to be the person, the caregiver. Here he can't do anything. You have to cope up. The caregiver have to cope up. The patient cannot, he won't listen to anybody. He will be in his own world. So you have to sit with him, whatever he says, listen to him and pamper him, hold his hand, move about him, whatever he likes, dresses or whatever, music, whatever you make them do that, listen to the music which he wanted to listen and move around, take him for a ride if he wish to go out, take him with you and go for a walk along with him. These are the important things. You should never question him. That's the most important thing. You should never be harsh, and you should have patience. Patience is important. If you ask him to dress, he will take 10 minutes to dress. You will not go and help him out. If he's taking time, let him do. That's the important thing. If he's falling down, then you can help him. That's how. If he's eating, if he's taking bath, just see that he's doing. If he's doing on his own, that's well and good. If you interfere with it, then the clash should begin. He will be, he will reciprocate basically. You have to find the ways, soft ways to handle that. You have to be soft and subtle with the patients.
Soft ways to handle it and a lot of patience. Thank you very much. Thank you very much, Dr. Aditya Singh, for taking time out and for answering so many questions that our viewers have asked. Thank you very, very much. And yeah, Doctor, any last words?
Thank you so much for giving me an opportunity to talk and interact with you. And it's lovely talking and sharing my experience with the viewers. And if you have any queries, just let me know. And Maheshwariji will thank you so much for everything. Okay, and it was lovely talking to you. And
we are in our own way doing a lot of things for keeping senior citizens engaged. We are a platform which is now over 3 years old. We have a magazine which is there and a website, and we do a host of events. For instance, we do Seniors Have Talent, which is now in its 8th season, and we're going to start the 9th season. Yeah, 9th season. We have Seniors Have Talent. We've had over 600 people who have participated, and all these are 60 plus.
That's amazing.
And we do the health webinar, and as you can see, people, all of them are above the age of 60 who ask questions. They are, and they are fairly Zoom literate. So, that's a good sign. And plus, we have a host of activities every week. In fact, I'm going to make one announcement today. We have something called the comedy workshop for senior citizens. We have a comedy workshop for senior citizens. I'm going to ask our producer to put in the creative on the chat. So this is a comedy workshop that we are going to start on October 31st. And this is being conducted by Jia Sethi, who is a well-known stand-up comic, and she's going to be conducting it. It's a small group that will ideate, will do various workshops, practices, etc., and will hopefully become stand-up comics, and you can have your own show. And Jia Sethi will handhold people who are there. So in this way, there are a host of activities that we keep doing at Seniors Today, which is we are there for the last 2.5 years. So thank you very much once again, Dr. Aditya Singh, for being here, and thank you to Apollo Hospitals for facilitating this.
My pleasure. I'll be in touch with you, and let's. I'll be a part of your. If you let's see how can I help you in.
Absolutely, sir. It's a pleasure to have you, and to all the medical fraternity who is always there whenever we need them. Thank you very much, Doctor.
Thank you so much. Thank you.